A neonate with DORV and severe pulmonary stenosis is born with profound cyanosis. Which medication should be started immediately? A. Furosemide. B. Prostaglandin E1, alprostadil. C. Indomethacin. D. Digoxin. Answer: B. Prostaglandin E1, alprostadil. Which physiological state is most dangerous for a patient with Tausigbeing DORV and no pulmonary stenosis? A. High systemic vascular resistance, SVR. B. Low pulmonary vascular resistance, PVR. C. High pulmonary vascular resistance, PVR. D. Normal sinus rhythm. Answer: C. High pulmonary vascular resistance, PVR. In DORV patients with single ventricle physiology, the first stage of palliation is typically A. Bidirectional Glenn. B. Fontan completion. C. Norwood procedure or PA banding, depending on flow. D. Total cavopulmonary connection. Answer: C. Norwood procedure or PA banding, depending on flow. What is the baffle leak complication in postoperative DORV? A. Dehiscence of the patch, allowing blood to shunt between the LV and RV. B. Obstruction of the coronary sinus. C. A tear in the tricuspid valve. D. Fluid accumulation in the pericardium. Answer: A. Dehiscence of the patch, allowing blood to shunt between the LV and RV. Which of the following is an absolute contraindication for a biventricular repair in DORV? A. Presence of a subaortic VSD. B. A straddling mitral valve that attaches to the right ventricle. C. The presence of a right-sided aortic arch. D. History of prematurity. Answer: B. A straddling mitral valve that attaches to the right ventricle. In a patient with DORV, subaortic VSD, and PS, what does a single S2 on auscultation signify? A. The pulmonary valve is closing early. B. The aortic and pulmonary valves are closing simultaneously. C. The pulmonary component, P2, is inaudible due to low pressure or valve deformity. D. The mitral valve is absent. Answer: C. The pulmonary component, P2, is inaudible due to low pressure or valve deformity. What is the most common reason for a patient with DORV to require a pacemaker post-surgery? A. Injury to the AV node during VSD/baffle suturing. B. Development of atrial fibrillation. C. Congenital absence of the SA node. D. Hyperkalemia. Answer: A. Injury to the AV node during VSD/baffle suturing. Which echocardiographic view is best for visualizing the subpulmonic nature of the VSD in Tausigbeing DORV? A. Parasternal long axis. B. Parasternal short axis, at the base. C. Suprasternal notch view. D. Subcostal four-chamber view. Answer: B. Parasternal short axis, at the base. Why do DORV patients with subpulmonic VSDs often develop Eisenmenger syndrome earlier than those with subaortic VSDs? A. They have higher systemic pressures. B. They are exposed to high pressure, high volume flow to the lungs from birth. C. They have fewer collateral vessels. D. The pulmonary artery is naturally smaller. Answer: B. They are exposed to high pressure, high volume flow to the lungs from birth. The Damas-Castansel (DKS) procedure may be used in DORV to A. Close an ASD. B. Create a pathway for the LV to the aorta when a tunnel isn't feasible. C. Repair a cleft mitral valve. D. Replace the tricuspid valve. Answer: B. Create a pathway for the LV to the aorta when a tunnel isn't feasible. Which of the following is true about double outlet right ventricle with L malposition of the aorta? A. The aorta is posterior and to the right. B. The aorta is anterior and to the left. C. It is always associated with situs inversus. D. It cannot be treated surgically. Answer: B. The aorta is anterior and to the left. A Blalock-Taussig-Thomas (BTT) shunt is performed in DORV to A. Reduce pulmonary blood flow. B. Increase systemic blood flow. C. Increase pulmonary blood flow in cyanotic patients. D. Fix a coarctation of the aorta. Answer: C. Increase pulmonary blood flow in cyanotic patients. Postoperative chylothorax is a known complication after complex DORV repairs. What is the cause? A. Injury to the thoracic duct during surgery. B. High right atrial pressure. C. Infection of the pleural space. D. Allergic reaction to the patch material. Answer: A. Injury to the thoracic duct during surgery. Which type of DORV is most likely to present with differential cyanosis, if a PDA is present? A. Subaortic VSD plus PS. B. Subpulmonic VSD plus coarctation/arch hypoplasia. C. Doubly committed VSD. D. Remote VSD. Answer: B. Subpulmonic VSD plus coarctation/arch hypoplasia. What is the primary advantage of the arterial switch over the Rostelli 4-Tausigbing DORV? A. It avoids the use of a valved conduit. B. It is a simpler operation. C. It doesn't require a VSD closure. D. It can be done in older children only. Answer: A. It avoids the use of a valved conduit.